My name is Thomas Yu. I am the System Director for Ambulatory Pharmacy Services here at Sinai Chicago. I help to manage the 340B program as well as our other ancillary pharmacy services. I've been here for 10 years. The 340B program was a federal legislation back in 1992. And allows for drug discounts to be passed on to covered entities like safety nets like Sinai Chicago. And these dollars can be used to, basically the intent was to build new comprehensive services for their communities. I would say there's mainly two ways that it benefits patients. Basically, you can expand or grow services. It's a way of financially justifying that. When a prescription is written, that has the potential of passing on a discount to the covered entity. It's a very unique mechanism to financially justifying those services. Basically, our endocrinology clinic that also serves our diabetes patients, for a number of years, we took advantage of providing discounts to our patients for insulin products. The prices of 340B have changed a lot in the recent years, but for many years, and even continuing to today, we still try to identify low-cost drugs that can be passed to those patients that can't otherwise afford it. Another way that we have utilized our 340 dollars is expanding our clinics. So, for example, our endocrinology clinic used to be one small clinic. Over the last couple of years, we expanded that to include a clinic both at Mount Sinai as well as Holy Cross, as well as giving that clinic more robust staffing, including a pharmacist to address medication adherence, as well as medication access issues, so prior authorizations and those kinds of things. We're able to better address that in a timely manner for patients. In health systems that are lower resource, it could take a much longer time to get responses back on those prior auths, as I think many patients kind of understand. Yeah, I think that's the biggest question right now with 340B because, generally speaking, I think for covered entities, we all play a critical role in this, especially us being a safety net institution. We all have our unique story of how we utilize those dollars. Some places, they need those dollars to keep services open. Other places, like Sinai, we've been able to use those dollars to expand on services. And again, I think when it comes to those direct patient cases where we do pass along those savings, those are also important stories. We do have, a number of case examples where, we are able to provide some curative medication. I remember years ago, there was this very sort of rare medication, not often used, oftentimes it's used for an infection of the brain, but it would have cost, the patient had no insurance, it would have cost thousands of dollars. The patient wouldn't have been able to afford care. But because the cost of 340B was so low in this circumstance, we were able to offer that to the patient and they were able to get treated. So, especially moving forward, I think we all anticipate that Medicaid dollars are going to be shrinking. And I think for safety net institutions, what is there to lean on? You can go to the state, you can go to, there's only so many places to ask. And I think that 340B has become even more important because it is the longer term solution. Grants and donations, those aren't always, I would say those are short-term fixes in certain situations for service lines. But when it comes to a service line that does require pharmaceutical treatment, 340B is a very unique opportunity to enhance the bottom line for that clinic, for that service line. So that way it's around to make generational changes for our patients and communities. I think it's really important to understand that, oftentimes 340B isn't discussed openly because it is so technical, but it is a very important piece of creating a sustainable service line. So restrictions that are occurring today with pharmaceutical companies, they have overstepped to a point where the services that we provide we are no longer able to get those same dollars back. So we're still providing the service, but we are not able to get those dollars 100% back to us. And I think that that's a key understanding, because that does make a difference. Covered entities have had to cut those service lines. Maybe it's a couple jobs, maybe it's a piece of that service line, but cuts have had to be made to make adjustments for these restrictions in place. And I think it's important to realize that these are the people that are helping your community directly that are being affected by this. These organizations like Sinai, like safety nets, like FQHCs, we are directly impacted by these changes. And I think it's really, really important to understand that, I think it's important to ask ourselves the question, are we okay with this? Are we okay with, less services? Because those dollars, they're not coming back into the community or affecting them. They're going back to, the pharma companies.